Hi, my name is Jay, and I'm the CEO and founder of Able Innovations. When I was a teenager, I began volunteering at long-term care facilities where my mom used to work. There, I witnessed her perform the back-breaking task of transfer. Transfer refers to the task of moving immobile individuals from one surface to another, be it from a bed to a wheelchair, or even taking them to the washroom, tasks necessary for the daily well-being. I saw the injuries my mom and her co-workers suffered and the physical and emotional stress this put on them. Presently, you require 2 caregivers operating archaic lifts and slings that suspend your loved ones in midair like a sack of potatoes, completely robbing them of their dignity. The fact that you require 2 caregivers to operate specialized equipment is also a big reason why families are forced to move their loved ones from their home into a long-term care facility in the first place. Fact of the matter is, patient handling and transfer techniques are extremely inefficient, unsafe, and undignified for all parties involved. You'd be surprised to learn that over 1 million of these transfers take place every single day in Canada. Each transfer requires an average of 2 caregivers, 8 minutes to complete, and when you sum up the numbers, the labor costs associated are over $12 billion every single year in North America. And due to the high rate of injuries, insurance companies pay out over $1.2 billion every single year. With our population aging at an unprecedented rate, these numbers are sure to grow, and the problems related to transfer are going to skyrocket. If only we could develop ways where we could reduce the resources required to transfer individuals. Families could stay together longer, and we could greatly improve healthcare outcomes. At Able Innovations, we're doing just that by developing technology that will be able to allow you to go from lying down in bed to moving around in a wheelchair effortlessly. Our autonomous, innovative devices will conduct transfer in an effortless, safe, and dignified manner. The core of our technology can be described as a compact conveyor belt that will roll underneath an individual, lift them up and over, and fold right back into the shape of a wheelchair. Our ultimate goal is to develop the Able Chair, a transformational device that is fully autonomous, can conduct all types of transfers in all types of settings, including at home. Where our technology is today is it is capable of conducting lateral transfers, which means it can lift individuals from the floor back up or transfer individuals between a stretcher or a bed in a hospital setting. In fact, we'll be sending one of our units to Briere Hospital just next month for evaluation. This is only possible today due to recent advancements in composite materials and AI, where we can envision a device that is fully automated, requires minimal training, and absolutely no effort from the tending caregiver. Presently, the status quo is you need 2 caregivers, 8 minutes to complete a successful transfer. With our device, you can do the same with just 1 caregiver, less than 4 minutes, and absolutely no physical effort. What this means for families is they'll be able to take care of their loved ones for longer at home. I can't emphasize how transformational this could be. For healthcare facilities, what this means is a single operator transfer would significantly reduce injuries, costs, and time of transfer, as well as significantly improve healthcare outcomes. In terms of numbers, we believe facilities will be able to save over $40,000 per device every single year. They can then redeploy the staff to conduct other essential activities. Most importantly, our devices will help restore a sense of dignity to our loved ones where they may feel that they may have lost it due to the current ways they're being treated and handled. In order to sell our products, we've developed 3 distinct business models. Ultimately, we will license our technologies to big players who already have sales and distribution channels. We've also developed a direct sale model where we'll sell our products directly to facilities with a big capital budget, such as hospitals. Our lease-based models is made for facilities with a low capital budget, such as long-term care facilities. There, for just a low monthly cost, they'll be able to benefit from the cost savings and additional features our devices provide. What's common in all these models is facilities will be able to recoup the cost of our devices through labor savings in less than a year. Further, we've also identified other industries such as logistics and veterinary care where our technology has huge implications. We've thoroughly studied a competitive landscape, and most products can be categorized in 2 categories. One being of transfer, such as the archaic lifts and slings I spoke about, and one being mobility, such as wheelchairs. Panasonic has recently come out with a device which is a bed that becomes a wheelchair. And while it's a great product, it doesn't address the need for transfer. We've also started seeing conveyor belt type transfers starting to be used in highly specialized use cases, such as on surgical tables. And this is a great vote of confidence for our core technology. What we believe we're different is we're developing the world's first combined mobility and transfer device, and here we feel we can make a big difference. In order to understand our market, we've involved key stakeholders through every step of our development. This has allowed us to develop influencers as well as industry supporters who've helped take our product a long way. We've also begun collaborating with leading academics in the field. We believe our early sales will come from the existing ecosystem we've developed, which will allow us to validate our value proposition as well as develop a scalable sales model. As we continue to grow, we'll develop partnerships down south in the United States for licensing and distribution. We know our customers and we know what they want. They want reduced costs, safer work environments, and improved healthcare outcomes. Our target market is guaranteed to grow, where over the next 20 years, the number of individuals entering long-term care is set to double. In just a short few months, we've received immense support from the local ecosystem. We've received funding from notable names such as NRC IRAP, Northumberland CFDC, BDC Bank, and AgeWell. We also have excellent industry supporters that include leading long-term care operators such as Schlegel Villages, hospitals such as St. Michael's Hospital in Toronto, Breer Hospital in Ottawa, as well as the Ontario Personal Support Workers Association that represents over 30,000 workers. We've also been fortunate to be members of leading accelerators in the world, and we are proud members of the Innovation Factory right here in Hamilton. None of our early success would have been possible without a stellar team. Myself and our CTO, Philip, are experienced entrepreneurs, and we've devoted significant funds of our personal money into this venture. Philip also holds over 15 patents under his belt. Our core team is 8 full-time employees, and we are supported by a great and diverse set of advisors. Overall, our team is extremely strong in the areas of product development, medical device manufacturing, operating long-term care facilities, as well as founding successful startups. In order to get to where we are today, we've greatly grown our team to address the challenges ahead of us. We're presently focusing on our alpha prototype, and towards the end of this year, we hope to have completed our beta prototype and conducted pilot sales. We hope to achieve break-even next year, and by 2023, we want to see our devices being sold directly into people's homes, helping them stay at home longer. In order to sustain this growth, we've recently leased our own facility in downtown Toronto where we conduct our prototyping and development activities. We've also begun partnering with supply chain partners such as PMCC in China, an organization extremely familiar with medical device manufacturing and one with whom I've had a personal relationship for over a decade. We've also retained the services of Bearskin & Power LLP for our provisional patents as well as our IP strategy. We've also begun developing a regulatory strategy, and for those who may be wondering, we believe we will be 510(k) exempt, which makes it a lot easier for us to achieve FDA and Health Canada approval. In the near future, we'll devote significant resources towards sales and marketing, capital into our IP as well as regulatory approval, and significant manpower into designing our products to be friendly with humans. By winning the LiONS LAIR award, it will be truly transformational for our company and allow us to be a homegrown global success story. By these funds, we'd be able to solidify unit economics, set up pilot studies, and set us up for a successful raise in Q1 of 2020. Hamilton has an excellent health ecosystem, and we've already begun partnering with organizations such as the Innovation Factory, Hamilton Health Sciences, and the McMaster Institute of Research on Aging. By winning these funds, we would then devote ourselves to partnering with this ecosystem to set up pilot sales. We've been extremely resourceful and efficient with our cash to date, and here it'll be no different. We have a stellar team that is poised to make a positive impact on not just the local but the global community. I ask you today to join us on this endeavor to help us improve the quality of lives of millions around the world. Thank you.